Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about stretching. Yesterday I commented about that we teach you some more about plantar fasciitis stretching, things that you can do at home to stretch out the plantar fascia. And there's two pieces of this puzzle that I want to make sure that you understand. First, number one, I want you to know that you cannot stretch the plantar fascia itself. So you'll see things online where they're talking about grabbing the toes and pushing the toes up so you can stretch that plantar fascia, or trying to stretch out your arch, or those kind of things. None of that's going to work. The plantar fascia is basically a ligament, which means it goes from bone to bone. There is nothing that can stretch. There's nothing that can improve it. You'll tear it or injure it or whatever. It does not stretch. It's not like a tendon that actually has muscle and that can actually allow it to stretch and so forth. So it does not stretch. So number one, you cannot stretch the plantar fascia. So you're going to stretch the areas around it. And really most of the stretching is for the Achilles tendon area. So number one, the best stretch that you can do is the Achilles stretch, or the gastrocnemius stretch. So there's two muscles at the back of the leg. You've got the gastrocnemius and you have the soleus. The soleus is deeper and does not cross the knee. The gastrocnemius crosses the knee. So when you do the runner stretch, where you put your hands on the wall, your feet shoulder width apart with one foot behind the other, and you lean forward, keeping your knee straight, you're stretching out the Achilles tendon. And as you stretch out the Achilles tendon, you're actually stretching the gastrocnemius area. So if you bend your knees and do the exact same stretch, you stretch the soleus. So typically, I recommend that you do both. Even easier, a lot of times what I will do instead is I will actually do a stretch on the stairs, where you put your toes on the edge of a stair and you drop your heels. And a lot of times I recommend that you do it somewhere where you can actually hold on just in case, because you don't want to fall, so forth. But as you drop your heels down, you'll feel that stretching of that Achilles tendon, and a lot of times it'll end up stretching both the gastrocnemius and the soleus muscle as part of that Achilles tendon stretch. The best way to do that is to do it, count to 10, do it 3 or 4 times, and then do it multiple times throughout the day. Commonly what I will recommend is if you're walking up or down the stairs, you stop, stretch, count to 10, do it twice, 3 times, then continue. The more you stretch throughout the day, the more help you're gonna get. As opposed to saying, okay, I'm gonna do it, stretch 100 times first thing in the morning. If you stretch 3 times, 10 times that day, you will get significantly more benefit. So those two are the gastrocnemius stretch, or the runner stretch against the wall, the soleus stretch, where you actually bend the knee and do the exact same stretch against the wall, stretching on the stairs. The other stretch that sometimes we will do is you actually take a towel or a band and throw it over the end of your toes and stretch the foot. Again, you're stretching the Achilles tendon. You're not trying to stretch the arch. You're not trying to bend the toes. You're actually wrapping that right around, just below the toes, right around the ball of the foot, so that you pull the foot up. And it's stretching that Achilles tendon actually helps quite a bit reduce the discomfort, reduce the pain in that area. So those are the main 4 stretches that you should do. You're going to get a lot more benefit and a lot more value in doing those type of stretches in helping improve the plantar fasciitis and allowing it to recover. There's basically a principle, whereas if you stretch out a tendon over a period of time, multiple times, over time the body actually adjusts that new position, and they'll actually lengthen that tendon, takes the pressure off, and alleviates the pressure across that plantar fascia by slightly lengthening the Achilles tendon. So that's the reason that you're stretching. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 107, stretching the Achilles tendon. And there are really 4 stretches you can do. You can do the runner stretch against the wall, which is the Achilles gastrocnemius stretch. You can do that same runner stretch, but bend your knees, and you will do a soleus stretch. And then you can stretch, put your toes on the edge of a stair and drop your heels. And then the 4th is throwing a towel or a band around the foot and pulling the toes towards you. This works really well, for example, in bed.